Okay, I have Dr. Eric Broadworth on right now. Thanks for joining us. We're going to be discussing ACL tears, specifically with return to sport. So appreciate your time.
Yeah, thanks for having me. I really appreciate it.
So one of the common problems that we probably both see is the transition when somebody is dealing with an ACL tear or a meniscus tear, and they're trying to get back to playing sports. They often don't transition smoothly, or physical therapy ends too early. So we're going to talk a little bit more about that in this interview. But first, just describe a little bit more about yourself, Eric, about your professional license, your specialty, and what you like to focus on and help people with.
Yeah, absolutely. Thanks for having me again. So I am a doctor of physical therapy. I also some other certifications I've got. I'm an orthopedic clinical specialist, so I'm a board certified specialist, and also a certified strength and conditioning specialist. And I work primarily. I'm in Grand Rapids, Michigan, and I work primarily with active adults and athletes. And I see anyone really ranging from high school athletes, college, all the way to professional. And so one of the main things, and that's why, I'm really happy to talk about this, that I see are people returning from knee injuries, specifically those that had a meniscus surgery or had an ACL surgery, and trying to get them back to that level that they were at, and really not only at that level that they were at, but above that level, to make sure that they don't have this injury again. So yeah, that's really my niche and my specialty.
Awesome. Thanks for sharing. What's the age group of people that you usually work with, just so we understand who this information might apply to best?
Yeah, so I would say I see a lot of people really primarily from 18 to like 45. Especially when it comes to knee injuries like this, like meniscus and ACL injuries, I would say those are really anywhere from 16 years old to 25 years old. That's the primary group. However, if they have some complications later, a lot of times that ends up showing up to, the 30s, 40s, 50s. But for right after surgery, it's primarily 16 to 25 for this age group.
Yeah, that's good. And I wanted to bring that up because there's a study done in 2018. I believe it's the Escape study, and it looked at people that were, I'm just confirming it right now, it's 45 to 70 years old with non-obstructive meniscus tears. I know we're talking about ACLs as well, but that's important because for people that were in that age range, it was shown that physical therapy was pretty much as effective as getting a surgery, getting a partial meniscectomy. And
Yeah.
so that's important because we need to understand who we're talking about here, because if you fall in a different age category, then this information may not apply to you as much.
100%, and I'm sure in that study it talked about this, but with atraumatic meniscus tears, meaning they're degenerative, they're chronic, they happen over time. Oftentimes, physical therapy can be just as good as surgery, if not better. I really try to avoid having any of my patients go under the knife if I'm able to prevent that. And so if you are in that age range where you're, 45 to 70 and you've got a meniscus tear and you've got knee pain, chances are that if you have not tried physical therapy, that physical therapy can help you and you can avoid surgery. So absolutely, I want to preface that before we talk about surgery and rehab after that. When you're talking trauma, it's definitely much different when you have a sudden blow or sudden impact and you're young. Um, yeah.
Yeah, great points to note. So the other thing, we'll transition to the ACL tears. And when you're working with patients with ACL tears, are they just getting ACL reconstructions? Is that primarily who you're seeing?
Yeah, so a mix of so they're getting the ACL reconstruction after a tear most often. I do have people that I've seen with an ACL tear that they tore their ACL, and we avoid surgery. So there is part of the population that is able to live without their ACL, and it all kind of depends on the individual's goals and the individual's lifestyle, but that can happen. But yeah, a lot of times too, with this being a meniscus group, ACL injuries and meniscus injuries can go hand in hand, and you can really see a lot of meniscus tears with ACL injuries. And so you'll have surgery for both usually at the same time.
Yeah, and that yeah, just for people that are watching this, this is also posted into my meniscus tear support group. We got, as of now, it's like December 3rd, we got close to 2,600 people in this group, and these are all people that are dealing with a meniscus tear, and it's really amazing because you get to hear from other people and you get to see what's really happening kind of behind the scenes. You know, sometimes when you talk to physical therapists, we might just highlight all the positive things, but this group, you get to actually see the struggles that people have. And sometimes, you know, therapy works great, and then sometimes people don't have a good experience. And so we want to try to maximize the percentage of people having a positive experience from physical therapy. And so that kind of leads us also into, you know, talking about how to rehab properly when you're transitioning back into sports. So like, what are some of the pitfalls and problems that you see with the way that people are currently rehabbing from an ACL tear or from a meniscus tear?
Yeah, so often what I find is there's a few things. One, a lot of times with ACL injuries and meniscus injuries as well, after you have a surgery, your rehab is broken up into phases. And so you have different goals that need to be accomplished based on these phases. However, I think one thing, as far as the phases go, a lot of people try to fit right perfectly in that bubble and progress based on what the timeline for the phase says. However, if they aren't appropriate and still aren't moving well, they likely should not progress to the next phase. So that's important too, for especially when we look at return to sport, because I know that was the main thing that we were talking about too. Is return to sport can be a main issue, and some of the gaps that I see with physical therapy and getting these athletes to return to sport is that there's a few things. One, we let insurance dictate things all too much. So patient, for example, gets 20 visits for the year for physical therapy. They had an ACL injury. And so you're trying to maximize those visits, and maybe they end up getting discharged early because you're like, well, they're out of visits. Well, as a physical therapist, we should really be doing our best to say, maybe we need to continue. And what does that look like? And really making sure that that athlete, by the time that they're discharged and they do go back to sport, that they're ready for the sport, that they pass physical exams and physical tests, and that they've been able to practice and do some of those other things appropriately and with the proper movement patterns before they get thrown into any competition.
Yeah, I can think of an example of that. It would be like they go, you know, go to their doctor for the follow up. They go talk to their surgeon, and then they clear them to start running,
Mm-hmm.
and maybe to start transitioning back to playing sports. And let's say they play basketball, and they're like, "Great, I can finally get back on the court." Maybe it's like a week or two before they see you. They're anxious to get back out there,
Yeah.
and they come back and tell you that they've returned to playing basketball, and you haven't really done a functional based evaluation or an assessment. You haven't looked at their performance with some performance based tests quite yet because that wasn't cleared by the doctor yet. You weren't able to jump or run or cut or do any of those things. And so then as you take them through some of these functional tests, you might find that they have extreme deviations with their knee. Their knee might cave in, like moving into like a valgus. And so I want to let you talk about that a little bit more. I don't want to steal your thunder, but I mean, what are some of the problems that people might actually have when they're trying to go back to playing sports?
Yeah, so some of the problems that they're going to have are definitely that proprioceptive awareness is a big one on their body mapping and where they perceive their body to be in space. So, for example, with a squat, are they able to squat symmetrically, or are they leaning and shifting to one side? They'll think that they're center, but then throw them in a mirror, and then they'll really see like, oh wow, yeah, I'm really shifting to the right side. Um, so that's one issue. Two is stability with quad strength is huge, and then also hip stability. So if they don't have that strength in the quads, one, they're not going to be able to push off or decelerate or control that deceleration motion that's needed to stop really quickly, and also to accelerate. But then also you need the hip stability and the core and trunk stability in order to control that knee. Otherwise, like you said, that knee can then valgus, and then you're at a much greater risk for another ACL tear, another meniscus injury. you're just setting yourself up for failure if those are not properly addressed. And so different tests can do those. So one of the tests that I really like is, it's called the Dorsa-V Athletic Movement Index. I don't know if you've ever heard of it, but I use sensors and actually videotape people so that way they can see the feedback. And so throughout their ACL rehab, we'll do different tests so that way they can see their progress, where their deficits are, and what they need to improve on specifically.
That's awesome. So do you actually put markers on to different landmarks, like onto the lateral aspect of the knee and the side of the knee, or on the hip?
Yep. So we'll do 2 on the back with these sensors, and then that'll be like at the base of the sacrum, and then roughly around like T12. And so measure some sagittal stuff. And then for the next portion, we'll actually put the sensors on the shin, and it'll track the amount of varus and valgus in degrees and give us objective measures. So we're not just relying on our eye to see, oh yeah, that knee is valgusing. No, we can actually measure it. And what's the difference between right and left? What are the speeds too that they can control? Because you'll see these people, if they don't have control that knee and that hip, they've got massive speeds as far as that knee's caving in that they cannot control.
Is this something that has to be done in person, or could you actually instruct them doing this online as well through telehealth?
That would have to be in person, unfortunately, because you got to hook the sensors up on them and everything like that. But technology is so advanced. I bet you there's something out there where you can literally put markers on them via telehealth and have them go through a screen. And that's just one, test and measure. There's a bunch of other ones. Obviously, you got your single limb hop test, triple hop test, all of these things too that can be very appropriate that you could do via telehealth and really measure a difference from side to side.
Yeah, that's good that you emphasize that. A lot of these tests can be done on telehealth. That's just setting up a call like this on Zoom. You just put your phone camera back, or your laptop camera back, your the webcam, and you can get a pretty good view of like an assessment of movement, and you can measure these things objectively. So that way you're just not guessing whether or not you have good quad control or you have good hip control. You can actually get some data on that.
Yeah.
And if you had a marker, that would be even more hard data. That would be something that could be analyzed and very accurate. So that's a pretty good idea for whoever invents that. Just a little sensor. I just got a new iPhone 12 Pro, which it's amazing. And then just like my brain is just thinking about all these different ideas of ways that it could be used, because it's got a LiDAR scanner on it. So you can technically create some software program that can detect joint motion. And it could be like a Microsoft Connect where you can actually analyze how somebody's moving in real time. So that would be amazing.
That'd be huge.
Yeah, it's excellent for ACL rehab. So is there a certain criteria when somebody needs to go back to playing sports that you like to follow? Or how do you know that somebody is actually ready to start to challenge the knee in different planes of motion without risking another ACL tear or injuring the meniscus again?
Yeah. So, the biggest risk for any injury is a previous injury. So anytime you're going back to return to sport after an injury, you do have a greater likelihood of injury. So the goal is to really decrease that risk as much as we can, right? So what I look for is symmetry between limbs and what's their quality of motion. That's a big thing that I think a lot of therapists sometimes forget about is that quality of motion, not only getting the hard data, but also looking at that quality. And so I'll look at that. Before they return to sport, I want to see how they practice, because we can at least during a practice or during some training sessions, we can try to simulate the environment, but also modify it so it's maybe not as risky. Because once you go into a game or into a competition, think of all the things that can happen. There's so many unpredictable factors when competition's involved, because both sides want to win, and that will to win takes over. And sometimes, that doesn't lead to the best results. So I really look for pain-free movement. That's a big thing for going back. I look for what are their objective measurements between both sides, quality of movement, what's their timeline too. You have certain people out there that are preaching, hey, you can be back after an ACL injury within 6 months. I would really argue against that. I really don't I think 9 months is often too early. A lot of the research is saying 12 months. I've seen research even saying 2 years. I think 2 years is too long. I think that's really waiting too long from like just humans, we don't want to wait that long to get back. So it all depends on the individual though. And that's the biggest thing as well, is try not to compare yourself too much to others. I mean, Adrian Peterson, he came back and had a record season, after like 6 months of rehab with an ACL, but the dude's a freak. So you can't really compare yourself to Adrian Peterson. Every surgery is going to be, the rehab after every surgery is going to be different, even if the same surgeon did it. So if you already had an ACL injury done, one, you need to take care of it that much more. If this is your second or your third, because you're at a greater likelihood, but oftentimes the rehab is going to go different because it's just the surgery is going to be different, even if it's the same surgeon.
Yeah, like it's great to get advice from other people, like the people in the support group that can read somebody else's comment or hear about their experience with rehab. That's good. That's good knowledge, and it's a good data point for them. Like, let's say they had an ACL tear and they got back to playing sports at 7 months. It's like good for them. That's great. That seems a bit fast, but that doesn't mean that that's going to be applicable to you. And likewise, if you fit the timeline for running, let's say your doctor clears you to run, that doesn't mean you're completely ready and you can just go 100%. Obviously, you're probably not going to start at 100% anyways, but um, that's just when you're able to do it. That's a guideline.
Yeah.
To make a better decision, to actually be more precise, to make a more well-educated decision to continue this, you have to do these functional tests. You need to be looking at the quality of motion, like you said, and that's often overlooked. Like, it's not just the ability to do something, it's the ability to do something with good technique, good quality, not fatiguing, minimal pain, because we're trying to improve not just like the short-term outcomes, but the long-term outcomes. Because the risk of a long-term outcome is really quite high. In this support group, a lot of people are struggling with arthritis in their knee after getting a meniscectomy, for example.
Yep.
They don't have cartilage in there. So if you've damaged your cartilage in addition to an ACL tear, then it's great to go back to playing sports. That's enjoyable, but you certainly want to be 50, 60, 70 years old and still be able to walk or jog. You don't want to have so much damage to the knee done.
Absolutely. With an ACL injury, within 10 to 12 years, you've already got arthritis onset. So looking at further complications down the road following that. But yeah, when you're talking about returning, those are exactly it. Returning to run, that is a guideline. I once had, so I had a surgeon with a patient once say, you can return to run. And this is 8 weeks post-op. This is very early, and was kind of shocking to me that the surgeon would tell him, yep, go ahead and you can start jogging and running now. So the first thing I asked the patient, I go, do you feel ready to run? And he goes, no. I go, we're not running. We are not running for another 4 weeks. So, and the reason being was this individual, his strength was not there. He had very poor control of his quads. He still had a tough time with any type of squatting movement, any type of like going downstairs. So if you have a tough time with squatting with two limbs, you then going to run, and basically running is little mini hops from one leg to the next. If you can't squat, then you're not ready for running yet. So just taking it easy and understanding that, like, hey, we want to do this right? You want to meet the criteria for the timelines for sure, but you want to do it right. You want to get the long-term outcomes to be positive.
Absolutely. And I'm glad you threw out some numbers with that, because I know that's a question a lot of people have, is they want to know, all right, how long, when can I get back? So you mentioned 9 months is too early. And that's often a guideline that's thrown out there that they might find somewhere through either their doctor or online, but really 12 months is where most of the research nowadays is pointing towards. But we really could extend that, up to 2 years, really, depending on how you're specifically progressing, because each person's going to be different. Your function, your control of your knee is going to be different from somebody else's. So we need to go off of that more than just a specific date.
Yeah, absolutely.
Anything else that you want to talk about when it comes to returning to sport for ACL tears?
No, I think I think you hit pretty well on all the main topics. I think just understand that while this support group is great, but listen to your body and what your therapist or healthcare professional and surgeon, what everyone's telling you, and really what you feel. If you don't feel you're ready, don't feel like you necessarily have to push it. But at the same time, it is going to be scary the first time that you try to return to sport. You're going to have that little voice in the back of your head saying, like, what happens if I re-injure this? That's normal. Just understand though, like if you've met those other criteria, more than likely you're going to be fine. And the more you do it, the more comfortable you will get with that as well.
Perfect. That's good. Well, Dr. Broadworth, if somebody wants to get in touch with you and get a hold of you and follow you, how could they do that?
Yeah. So you could either, you could throw me a friend request on Facebook, just Eric Broadworth. On Instagram, I'm at drericbroadworth.dpt.ocs. And then email is just eric@fuelphysicaltherapy.com.
Perfect. There you go. And appreciate your time today. Thanks for sharing more information about ACL tears and also a little bit about meniscus tear recovery too.
Absolutely. Thanks for having me.
All right. Take care. Bye-bye.